Ian asked if he could see my speech to make sure that we didn't repeat each other's words. He stole half my speech. But I would like to thank Trent University and the Alumni Association for this award this evening. We have had a wonderful weekend, and it was fun getting all dressed up tonight. We shared lots of old photos. Ian had hair and glasses in the old days, and we've had lots and lots of fun. It is a bit embarrassing having your husband nominating you for an award. We're blaming that partly on Tony as well, though. But thank you very much, Ian, for watching over House and Hearth as I went out and did my thing. Trent's a really big part of our lives. In fact, Ian wears a Trent signet ring and not a wedding ring from me. No, I gave it to him, though. So neither of us use our Trent degrees professionally, but we always believe really strongly in the value of a university education. I don't know if you remember the board game, the Game of Life. Our generation will remember a board game. But our son Ben, when we played that game, there's a crossroads where you can choose career or college. And we always wouldn't let him take the career. We said, you're going to university, that's your pathway. So we all learn and grow at a university, but prior to tonight, my greatest honor at Trent was breaking down gender barriers as a member of the championship boat racing team. And that has nothing to do with rowing on the river. We're from Cambridge, and Cambridge is a community of 125,000 people, about an hour west of Toronto. And like all small towns in Ontario, we suffer from a shortage of family physicians. I believe really strongly, and I'm very passionate about every Canadian's right to have access to their own family doctor and accessible one-tier health care. It's been suggested, thank you. Suggested that many emergency room visits and hospital admissions can be considered failures of our current healthcare system, as failure of prevention and of timely and of the effective care that a family physician can provide. And I believe that I can make a difference in Cambridge. So I volunteered my services with the Doctor Recruitment Task Force. As a professional realtor and a salesperson at heart, my hope was I could assist the bureaucrats by selling Cambridge to touring doctors. We met with some success, but overwhelmingly found that even though they loved Cambridge, they couldn't find the work environment they were looking for. The model of a sole practitioner working in an old house 60 hours a week isn't popular with new doctors. They want a clinical setting where they can collaborate with others. They want a manager in place to run the facility. They want a work-life balance. And our task force mantra did become, if we build it, they will come. So I chaired a new board, and we prepared a professional business plan and went to the city council for some funding. This is a huge ask. You've got to remember that healthcare is a provincial responsibility, not municipal. But our councillors, the mayor, and the CAO all supported our plan. They gave our board a grant of $250,000, and they co-signed a note for the balance of our clinic. I can remember sitting in my car that February after the council vote, and I was ready to cry. What had I gotten myself into? What had I promised these people that I could do? But with the lease in place, we did build out a 7,000 square foot medical practice. We've made a joint application with the Ministry of Health. We became a new family health team, and that's a collaborative model that the new doctors like. Today, we have 7 doctors, a nurse practitioner, and a complement of healthcare professionals working out of the site. And 10,000 Cambridge residents are off the waiting list for a family doctor. Like many of us here, I've sat on my share of not-for-profit boards. And as a business owner, I felt I had the skill set to ensure that our not-for-profit worked towards economic success. You've got to remember that the rules for a not-for-profit corporation is that the corporation can succeed financially. We just have to ensure that the directors and the officers don't benefit personally. The city had respect for our unique all-business approach, and as we recruited doctors, they too had the confidence in the nuts and bolts of our business model. Today, charitable organizations and not-for-profits are all fighting for our attention. And I do believe that an entrepreneurial outlook and a keen business model can set your organization apart from others. So if you run a successful business, I believe that you have an incredible skill set to offer a volunteer organization. There's one more reason I encourage each of you to volunteer. Did you know that there's actually a helper's high? There's research that proves there's powerful physical feelings that people experience when directly helping others. And a helper's high can explain real benefits to a volunteer's physical and emotional health. People have known forever that helping others is good for the soul. But now it's proven it's good for your body and your mental health too. Regular helpers are 10 times more likely to be in good health than those who don't volunteer. Apparently, helping others reduces the body's stress and it releases endorphins, your body's natural opiates. A lot of times we think that happiness comes about because you get things for yourself. But it turns out, in a paradoxical way, that giving gets you more. And that's a pretty important message in a culture today that's pretty often about getting messages to the opposite effect. So, I, like many of us here, am an urban geographer by education, but maybe what I learned at Trent is part of my life today. That I can work towards making my city better, the continuity of healthcare, it truly affects the total health of individuals, and it creates a healthier community. Again, I thank Trent, the Alumni Association, the Affinity sponsors, and all of my friends and family for participating in this wonderful journey. Thank you.